He came into the emergency room yesterday with complaints of sore on his toe and heel. He doesn't live here in town. He's only here for 2 weeks with his cousin, but his cousin noticed that it was getting really bad and made him come to the emergency room. So he was admitted yesterday. He had a wound debridement today. He just got back from the PACU. He is not voided after the surgery. He has an IV of half normal saline. It's in his right hand. He has dressings to his big toe and to his heel. There is some swelling up the calf. He's on a diet, an ADA diet as tolerated. He's on bed rest. He can dangle that foot this evening. He's alert and oriented. He was quite anxious before the surgery. His last finger stick at 11:30 today was 170. His next one is due before dinner time. And he was treated with 1 unit of insulin at that time. His pre-op lab showed an elevated white blood count and an elevated SED rate and A1C. He has not voided since coming out of the OR. He is a full code.
Okay.
Any questions?
No. Any allergies?
He is allergic to iodine.
Okay. And has he been given any medications?
Not since he has come to the floor.
Okay.
Good.
I think so.
Okay. I will be speaking to you through the intercom as a patient. There is a delay, so if I don't answer you right away, it's because it's a delay, okay?
Okay.
So he doesn't leave the town. His cousin brought him in.
Okay. You ready?
Yeah. Here is the thing.
There's what thing?
Ready, Katie Boo? Okay. Ready, go.
Hello,
Hello, Mr. Redding.
my name is Katie. I'm gonna be your nurse today, and this is Jaja. She'll be helping me out.
Hello.
Can you tell us your full name and date of birth?
My name is Messiah Hedding. My date of birth is August 14th, and I'm 62 years old.
Thank you.
Alright, and do you have any allergies?
Yes, I'm allergic to that orange stuff. I think it's called iodine.
Alright.
Thank you.
So I'm gonna start by getting your vitals.
And I'm gonna start doing your assessment. I'm gonna listen to your heart and lungs.
Okay.
Let me just put your oxygen properly.
Get your O2. IV is running. O2 is at 98%.
Good. That's hooked.
Heart rate is 92.
Are you in any pain, Mr. Redding?
Yes, my foot hurts really bad.
Okay. I'm gonna check medication, Katie,
Okay.
and then I'm gonna do the assessment.
Okay. All right. Yeah, your heart rate's a little elevated.
Is there anything you can do for my foot? It hurts bad.
Let me take a look at it and see. So you have some dressings on it.
Oh,
Where?
it hurts. I'll be careful. I'll be careful.
Okay. Can I get you an ice pack?
Maybe we can try ice
I
pack.
don't know. Will that help? Oh,
I know. I don't want that heel to be resting on the pillow. That's the only thing. I'm going to grab an ice pack and we'll see if that'll help until she can get you some pain medication. Okay. I'd like to see if there's something I can, I don't know whose sweater that is. Okay. If I hold this,
oh. Careful. That hurts.
okay. Where on your foot exactly hurts? Is it in the wound site?
My foot just hurts all over. I just hurt.
Okay. Well, why don't I put this ice pack here for now? She's getting you some pain medication. Matthias, can you tell me where you are?
At the hospital.
Okay. And what year is it?
Uh, 2018.
Right. And yeah. What month is it? What month are we in?
My state time.
April?
Good. Good. So you don't live around here, huh? Where do you live?
I live in Southern California.
Reading. What's it like this time of year?
It's okay. It's been raining a little bit.
Raining, yeah. BP.
There's 2 pain medication that you can take, Mr. Redding. You have morphine and Tylenol. Which one?
Whatever's gonna work the quickest because I really hurt.
All right, I'm gonna give you some morphine then.
Then I'm going to count your
Oh, morphine. Isn't that the drug that you become addicted to?
If you want to get his medication ready, I can talk to him about the medication. That way
Okay.
you're not back and forth.
Thank you.
Yeah. So a medication, it is an opioid pain reliever. There are some, people can become addicted to opiates, but generally speaking, if you only use it as it's prescribed to you and for a short period of time, your doctor's not going to prescribe you enough to where you're going to be addicted. Usually addiction comes when people start using too much of the drug or they use it too often. But for right now, you just got out of surgery. I think that the morphine is going to help you. I do want to check how many breaths you're taking per minute because morphine can cause some shortness of breath. So I want to make sure that it's not affecting you like that.
Okay, I'll try not to hold my breath.
Don't hold your breath. Just breathe normal for me. And
It says I can give 2 milligrams every 2 hours PRN. He didn't have any morphine since then.
okay.
So
And his respirations are 20 per minute, so I think it's okay.
it's okay.
Besides the pain, how are you feeling?
You know, I had a friend who took morphine and he ended up being an addict and it was horrible. It really scares me.
It does. Have you ever taken morphine before?
This is 1 ml.
He gave me a dose of it yesterday and it worked pretty good.
Okay.
But
I think right now what we're most concerned about is making sure you're not in constant pain. What we can do is every now and then, if your pain is really bad like it is right now, we'll give you the morphine, but we can give you Tylenol between those times to keep the pain at bay. Of course, Tylenol is not, you know, the magic pill. That comes with some bad side effects too if you take too much Tylenol, so we don't want to keep pumping you full of Tylenol either.
Okay, I didn't know that, because I take Tylenol at home all the time.
Do you? Yeah. You know, generally, they say it affects your liver, so if you take too much Tylenol, it can really cause some damage down there. How much Tylenol did you say you take?
Take 2 or 3 of them. Some days when I hurt all over, if I work out in the yard, I'm taking every 4 hours, like the bottle says.
Okay. Yeah, the bottle usually gives you a pretty safe dose, but I mean, still, you don't want to take it every day. You might try something like ibuprofen or talk to your doctor about maybe there's a medication that can give you pain relief that's better than the Tylenol does too.
I get so vivid, and when my foot hurts so bad that I have a hard time breathing, and I think I hold my breath or something.
Didn't quite hear you. What did you say?
I said, I get this sore when my foot really hurts. I think I hold my breath.
Yeah, when people are in pain, our body does funny things like that. But we ask that you don't hold your breath, and especially after you get the pain medication and, hopefully your pain starts going away, it should be better.
Yeah, I hope my pain goes away. Where that pain
It's coming.
She's coming. With it being a narcotic, sometimes it takes a little longer to get ready just because we want to make sure that we're giving you the right dose. Okay.
Knock, knock.
Hi, Jaja.
Take this where it starts working.
So morphine, especially when it's given to you in your IV line, which is how she's going to give it to you, it should have a pretty quick onset, maybe not even 10 minutes. Yeah, about 10 minutes?
Mm-hmm.
Okay. Yeah.
All right, Mr. Redding, is it okay if you state your name and date of birth for me?
My name is Matthias Hedding. Good age. August 14th. I'm 62.
Okay, thank you. And I'm giving you morphine for pain, and hopefully it will help out.
Promise I won't become an addict.
Oh.
No, you won't.
You got it okay?
Yeah.
So she's going to put it in your line, and that's just, it'll be quicker than giving you a pill anyway, so.
I'm not gonna flush it because can I just kink it?
Mm-hmm. Or it's still running, I don't think you want to keep it.
Stop.
Just, is there a pause?
Clear.
No. Yeah?
100 ml per hour.
Okay.
80 ml. Or can I just kink it over here?
Yeah.
It will beep, beep, beep. Okay. Here we go, Mr. Redding. And I'm giving it
Over
between
2 minutes.
2 to 3
Just
minutes.
put that in really fast. Get it to work. My foot really hurts.
Well, we can't just do that, Mr. Redding, because
That's okay. Especially because you're worried about, you
Name
know,
is Hedding with an H.
Hedding.
Heading. I'm sorry.
Especially since you're a little worried about, you know, morphine being addictive. The faster we push it in, the more likely you're gonna feel that euphoria, which can lead to addiction. So we want to push it over about 2 minutes just to be safe. We don't want to cause any, you know, respiratory distress either, but it's going to work. It should only take, you know, a couple minutes once it's all pushed in. How is that ice pack doing?
Okay. I honestly don't know. My foot just hurts so bad.
Yeah,
Hopefully this will help you.
yeah, the morphine will help. So you're here from Redding. Do you have any family in the area?
My cousin James lives here. That's who I'm visiting.
Oh, good. Has he been coming to see you while you've been in the hospital, or is he steering clear?
Yeah, he was here. I saw him right after surgery, but he had to go home and feed the animals.
Okay. Well, maybe we can, would you like to see him, and maybe we can see if he'll be coming back?
He'll be back this evening. He runs a ranch here. He's got to do the hay and stuff.
Oh, yeah. Sounds like he's a busy guy, but I'm glad that he brought
Just
you
putting an
in.
awful lot of medicine in there.
So this second syringe, that's full of saline water, which is just like the stuff you're getting through your IV.
So that the medication will go through your...
Yeah. And we want to make sure that it's all clean and
All
that the medication made it to you. So while that starts to take effect, I think we're going to let you rest unless there's something that we can do for you right now before we go.
Okay, I am getting a little sleepy.
A little sleepy. And how is your breathing right now? Would you say that it's easy breathing, or are you feeling any shortness of breath?
That's fine. I'm getting tired.
Okay. I'm going to take this time real quick just to listen to your lungs, if that's okay with you.
Do you want me to check the wounds, Katie?
Okay, whatever.
Sure. Yeah.
Okay.
So I'm just going to listen to his heart and lungs before we go. I'm going to listen to your lungs before you fall asleep. If you could take a couple deep breaths for me.
Now that you got pain meds, is it okay if I check your wounds? Here we go.
Oh, it hurts a little bit.
Okay, promise to be gentle. Here we go.
Okay.
I'm not gonna touch it. I'm not gonna... Okay.
Your lungs sound okay. There's a little bit of crackles
Can't
in
hear
there.
anything with that thing when you're listening through my clothes.
That's true. That is.
I'm gonna check pulses on your feet. I hope I can feel some.
And now I'm going to listen.
Careful.
Now I'm going to listen to your heart so you can breathe normal.
I don't feel anything.
Thank you for being so gentle.
You're welcome.
That other nurse that checked my foot really hurt me.
I'm sorry.
Sorry.
I think her name was Debbie or something, you know? She's got a hyphenated last name.
I'm sorry to hear that. But your heart and your lungs sound fine. Again, before you fall asleep, can we sit you up so I can listen to your lungs in the back? And then I promise we'll let you rest.
I'm gonna.
No, can we do that later? I'm really tired.
I'd like, since I just got on shift, I'd like to know what they sound like. That way I know if something changes later in the day. It'll be real quick though. Jaja will help me. You want to just help me sit him up?
Okay, you want me to
All
put?
right, whatever you have to do.
Thank you. Here we go. Ready? 1, 2, and 3. Take a deep breath. Another one.
Okay. You sound good. So like I said, we're gonna let you rest, but I'm gonna leave you.
It just doesn't want to stay in my nose.
Nope. Your call light is right here if you need something. Otherwise, here's your water. Otherwise, we're gonna let you rest. We'll be back in though to check on you in maybe
30 minutes.
30
I'm gonna
minutes.
check for pain. I'm
Okay.
gonna assess the pain again.
All right.
Are you
Take it
comfortable?
out. Thank you.
Put the railings up.
Oh yeah. Okay. Hang on. We'll stay.
Okay, you're both done.
Okay.
Thank you. I told you I don't